Halo saudara, apa kabar Anda hari ini? Semoga selalu dalam keadaan yang sehat, semangat, dan juga baik. Saudara, kanker perut atau gastric cancer masih menjadi salah satu penyebab kematian tertinggi di dunia, termasuk di Asia. Namun, kabar baiknya, kemajuan medis kini membuka harapan baru, mulai dari penggunaan antibodi inovatif hingga pendekatan molekular testing dan juga imunoterapi yang semakin presisi. Nah, hari ini kita akan membahas bagaimana teknologi medis terkini mampu mengubah perjalanan pasien kanker lambung dari deteksi dini, pilihan terapi, hingga perawatan personal yang dirancang khusus bagi setiap individu. Lantas apa saja terobosan baru yang kini tersedia di Singapura, dan bagaimana OncoCare Cancer Centre berperan sebagai pionir dalam menghadirkan perawatan kanker yang menyeluruh di kawasan Asia. Selama 30 menit ke depan, kita akan mengulasnya secara lengkap bersama dengan saya Melisa Gansari, hanya di Bincang Kita. Sudah hadir di sini bersama dengan saya di studio Kompas TV, dua orang dokter dari Singapura. Kita sapa terlebih dahulu tamu saya hari ini. The first one I would like to welcome my guest, Dr. Thomas So, the Senior Medical Oncologist from OncoCare Cancer Centre, Singapore. Halo dokter, apa kabar?
Kabar baik.
Kabar baik. Can speak in bahasa, but we do interview in English ya.
Boleh.
And also my second guest is Dr. Kim Koh-wei, the Senior Consultant General Surgeon, General Bariatric and Upper Gastrointestinal Surgery from Press Surgical Practice. Halo Dr. Kim.
Hi, how are you?
How are you? I'm nice, thank you. Thank you for coming to Kompas TV.
My
We would
pleasure.
like to discuss about gastric cancer. Okay. The first question, this is for you, Dr. Kim. One of the major causes of stomach cancer is H. pylori infection. How important is early detection to remove this infection in preventing cancer development, doctor?
H. pylori is a short form for Helicobacter pylori. It's a bacteria that is quite prevalent in Asia. Generally, about 15 to 40% of people can carry this bacteria. It's known to be a major risk factor for both stomach ulcers and stomach cancer. It's important for us to detect it early and to treat it, because if you treat H. pylori, you can actually reduce the risk of stomach cancer in our patients. So we adopt a test and treat approach.
I see. The numbers is so high, 15 to 40% of people carrying the H. pylori bacteria. I see. So for the general public, what are the early warning signs they should watch out for stomach cancer reaches an advanced stage?
It's important to remember that if you have a patient with early stomach cancer, many patients actually have no warning signs or symptoms, so it can be very silent. However, if a patient has persistent pain in the upper stomach, worsening or new onset pain or discomfort in the upper abdomen, it's important for them to see a doctor early and to get assessed and to consider medical treatment.
I see. So if you have a pain, don't take it longer, just see the doctor. So if we can detect it earlier, it's the more better for the patients. Okay, so I'm going to go to Dr. Thomas then. How significant, doctor, the tumor testing in determining the most effective treatment strategy for patients at OncoCare?
Actually, this is the most important step. Every patient is different. Every cancer is different. So tumor testing such as molecular testing and immunohistochemical staining, which is basically putting some paint on the stain to identify certain targets, will allow us to better understand the cancer and identify other options for treatment other than chemotherapy. Chemotherapy is a very blunt way of treating cancer, kills both good and bad cells. By using specific antibodies, this is also known as targeted therapy, we are able to better target tumor cells. And there are new antibodies that are always being identified, and this will allow us to tailor the treatment specific to the patient. Besides targeted antibodies that allow us to just target the tumor, we nowadays have also targeted chemotherapy, where the chemotherapy is actually combined with the antibody to deliver the chemotherapy directly, right, to the tumor cells. There's also, of course, immunotherapy, which we will talk about later.
Yeah.
Instead of just killing cells, we are actually also using the body's immune system to help treat cancer.
Okay, so the testing not only for knowing that that you really got the cancer, but also you do the test for know what treatment to do with the patient also.
Exactly.
I see.
Yes.
So the testing actually becoming so important. How can education and preventive campaigns help reduce the incidence of stomach cancer across Asia, doctor?
So it will be interesting to know actually that stomach cancer worldwide, in terms of the percentages, have been coming down. This is because there is better standards of living. Invention of the fridge actually reduces the need to actually preserve meats, preserve food, and all these are known risk factors for stomach cancer. Of course, people are also now a bit more conscious, and therefore they are improving in their diets, and so we hope to actually do better, right? Even though stomach cancer rates have been coming down, we want to reduce it further. So Dr. Kim has mentioned, right, that we want to actually advocate screening. If more patients start screening, meaning to say if they are well or even if they have little bit of symptoms, it will be good to see a doctor to get checked. And if we identify certain risk factors such as H. pylori that we are talking about, then we can reduce the risk of cancer. We want to prevent cancer from even before it happens.
Okay, I see. But many people come to doctors when it's already worsened to the advanced stage. What are the reasons from that patient? Are they scared or they don't recognize the symptoms? What happened, doctors?
Yes, I think that's a very important question. And actually, if you look at the data, about 60 to 70% of people see a doctor who are diagnosed with stomach cancer, actually presenting at a very late stage, stage 3 or stage 4. And this is because at stage 1 and 2, when it's early, like I mentioned earlier, you don't get much symptoms.
Yeah.
And so this is something that is a difficult problem that we have to address here.
Okay, so the screening testing that becoming more important because sometimes when it's early stage, you cannot feel anything, you don't have any warning signs, but when you come to the doctors, maybe it's already at the advanced stage and it's harder for doctors also to treat the cancer also.
So what we do is that we try to combine both the symptoms of a patient, because it can be very mild, with a risk profile of the patient, like Dr. Thomas mentioned, the risk factors that we look through. And if they have both risk factors and some symptoms, then we will have a low threshold, or we will be more inclined to screen or to check these patients.
Okay, so do regular testing and also know your factors from your family history that are becoming more helpful. Okay, we will discuss more about the treatments and the therapy, but we have to take a break for a while. We are going to back with you again. Jadi saudara, jadi Anda juga jangan kemana-mana, kami segera kembali tetap di Bincang Kita. Anda kembali di Bincang Kita, saudara. Kali ini kami masih membahas seputar kanker perut atau lambung. Saat ini saya masih bersama dengan para dokter dari Singapura. Ada Dr. Thomas dan Dr. Kim Kowe di sini. We're discussing more about gastric cancer. Before we are speaking about the testing, also the warning signs from this cancer. Now we're going to talk about the treatments. So, Dr. Kim, what are the recent advances in surgery for stomach cancer?
Yes, there are two main advances in recent years for stomach cancer surgery. One of them is what we call lymph node dissection. So when you have stomach cancer, when it's early, it's just in the stomach. But as it gets into more advanced stages, the cancer tends to spread to what we call lymph nodes. These are areas around the stomach, near the blood vessels that supply the stomach. And we know from data that if you do surgery for the cancer alone in more advanced stages, and you leave behind lymph nodes that may harbor or may have cancer spread to them already, the results are not that great. So these days, when we are doing surgery for stomach cancer patients, we have to take both the tumor in the stomach, the cancer in the stomach, and also the lymph nodes around. And we do this in a procedure that we call D2, a D2 gastrectomy, or removal of the tumor and the lymph nodes around it. So that's one of the main advances recently for surgery. The other major advancement in recent times for stomach cancer surgery is the use of minimally invasive techniques in what we call keyhole or laparoscopic surgery. So instead of a big cut to remove the tumor, these days 90% of the time we do keyhole, small incisions, and through these small incisions we can do laparoscopic surgery to remove the tumor and the lymph nodes around.
Okay.
Yeah.
Not only laparoscopy, but also there is the use of robotic systems and also AI, artificial intelligence, that has been increasing medicine. Can these advances be used in the treatment for stomach cancer, doctor?
It's good that you bring up both AI and robotics. Robotics is something that is even more recent.
Yeah.
It's an advanced form of laparoscopic or minimally invasive surgery. Using robotic instruments, we can do very precise surgery with very good 3D magnified visualization. So we do very stable, very safe surgery with hopefully improving outcomes for our patient with stomach cancer going for major surgery. The other part about AI advancement in stomach cancer would be more in terms of stomach cancer detection. These days when we do endoscopy to look for a tumor to diagnose stomach cancer, we usually use AI during the scope so that we can improve the detection of early stomach cancer. And we can even come to the diagnosis of stomach cancer at the point of the time when we're doing the scope without waiting for biopsy results.
Okay, so technologies do really
Yeah.
help the doctors and also the patients for treat the cancer recently. Okay, not only for surgery but also for the treatment. In Singapore, some of these new therapies have been approved faster than in neighboring countries. How do patients get access to this, doctor?
I think for a new treatment to be approved, they generally go through clinical trials. So clinical trials usually compare a new treatment either on its own or in combination with a standard treatment. So through clinical trials, patients are already getting approved early access to new medications even before they are actually commercially available. So in Singapore, we tend to get approvals for these medications because Singapore is a large center where there are many clinical trials that are ongoing. And in general, when a drug is approved for use, when they have actually been shown to be effective, they tend to be approved in countries that have conducted these studies. Yeah. So a lot of medications may not be available in other countries, and so they tend to be approved in countries like Singapore first.
Okay, that's why Singapore is faster, and for the patients who are searching for the new medications can go to Singapore then. And recently, several new therapies are available for stomach cancer patients. Could you explain how this drug works and how promising it is for the patients?
There are many non-chemotherapy types of treatment that's approved for use in stomach cancer. One big group are targeted antibodies, another big group is immunotherapy, and another big group is actually targeted chemotherapy. So what are targeted therapies firstly? So as its name implies, there is a target on the cancer, and we use special antibodies, right, that binds to these targets like a lock and key. So imagine that if this is a key and this is a lock on the cancer cell, pretty much it fits nicely. Yeah. And so when the antibodies bind onto the tumor cells, it signals a series of events and it actually alerts the immune system to actually identify the cancer cells better and kill them. So targeted treatments are more specific to cancer cells, and we hope that in general they tend to have less side effects and all. Immunotherapy is another breakthrough in cancer treatment over the years. So what happens is that cancer cells have a natural ability sometimes to hide from the immune system. They can actually be in the presence of the immune system, in the presence of white blood cells, but the white blood cells are prevented in some way to actually kill them. Yeah. So immunotherapy is a type of treatment where we infuse a medication, also an antibody, that helps to break the chains and allow the body's immune system to identify the tumor cells and kill them. Yeah. Now, even more recently, there's actually a targeted chemotherapy. The actual medical term is actually ADC, or antibody drug conjugate. Basically, they are chemo on one side. Remember that lock and key?
Yeah.
Now imagine the lock and key, and this time round, my sleeve is holding the chemotherapy.
Okay.
So when they bind to the tumor cells, we are actually releasing chemotherapy directly to the tumor cells. So these are all the new breakthrough advances, and through clinical trials that are ongoing, you are always constantly trying to identify even more targets and even more ways of treating.
Okay, the cancer got clever. We more clever than the cancer.
We hope so.
We battle the cancer together. Okay, we will discuss more, but we have to take a quick break. We'll be right back with you. Jadi saudara Anda juga jangan kemana-mana, tetap bersama kami hanya di Bincang Kita. Terima kasih saudara, Anda masih bersama dengan kami di Bincang Kita. Saya masih bersama dengan para dokter dari Singapura, ada Dr. Tomaso dan juga Dr. Kim Ko Wei. Kami sedang membahas mengenai gastric cancer atau kanker lambung. Baik, Dr. Kim, I would like to ask about the surgery. So how do different doctors work together for ensuring that patients receive the best possible outcomes?
That's a very good question, because in the modern treatment of stomach cancer, we realize that it's not one doctor treating the patient these days. We have a big team of doctors, which starts from the endoscopist, who diagnoses the tumor, to the pathologist, who looks at the biopsy slide, to the radiologist that looks at the scans, and you have a medical oncologist like Dr. Thomas, surgeons like myself, and we come together to discuss what is the best treatment. And this is because for many patients with stomach cancer, they don't just require only surgery to remove the cancer. Oftentimes, you should have a combination of surgery with chemotherapy, targeted therapy, or immunotherapy to give the best outcomes for patients.
Because not only they're coming at the early stage, but if you already coming in advanced stage, they already maybe are spreading. You have to do the oncology treatment also. Not only for the surgery like you've mentioned before, right?
Partially true. If you're looking at stomach cancer, it's a very aggressive cancer. So when we mentioned stage earlier, there are 4 stages. And generally, if it's a stage 2, 3, or 4 stomach cancer, oftentimes it's best to have an oncologist's opinion to see how we can combine treatment to get best outcomes.
Okay. So for stomach cancer, when can surgery alone is enough for the patient?
Generally, surgery alone or removal of the tumor alone is usually sufficient only if it's very early, stage 1 cancer. In that situation, sometimes we can do minimally invasive surgery alone, or we can do even endoscopic surgery, where you don't even need surgery to remove the tumor.
Okay. So if you come earlier, then
The earlier the better.
the earlier the better.
The easier the treatment, the better the outcomes.
That's why you have to do the screening regularly,
That's right,
so you can see the symptoms in very early. Okay. So, doctor, in stomach cancer, the patients sometimes have to remove not maybe just the part of maybe all of the stomach. Is that dangerous, and how can they live after that?
And, also a very nice question, because many patients with stomach cancer, when we talk about surgery, they get very anxious and very scared.
Yeah.
The truth is that when we remove stomach, the part or whole of stomach, generally what we do is that we join the small intestine below to the remaining stomach or to the esophagus, the food pipe. And this allows the patient to be able to eat even after surgery. And many of patients, after a few months of adjustment, actually go back to their normal diet. They can eat normal food. They can live normal lives for many, many years once their stomach cancer is cured. So really shouldn't be too scared about it. Just have to bear in mind that there are some adjustments in eating. They may initially have to eat smaller meals because you don't have a stomach anymore, and more frequently. In the long term, because the stomach is removed, some of them will need to be on some supplements like iron or vitamins and so on, and they have to be monitored on a yearly basis in the long term as well. In terms of short-term recovery with surgery, we find that with the use of laparoscopic or robotic, which is even better, surgery, we find that patients recover faster. Most of patients who go for stomach cancer surgery are actually walking and moving around on day one. Some of them are even allowed to drink and to have fluid and some soft liquid foods within a few days after surgery.
Okay.
So we find that with good advancements in treatment, patients do better, they recover faster.
Okay, so no need to test yourself because you're scared that you are sick. But actually, if you can know this screening earlier, you can be treated well, or maybe you don't need to remove all part of your stomach then.
Yeah, so
Okay,
that's right.
okay. Then I'll go to Dr. Thomas then. So is there a significant difference, doctor, between these new treatments and the chemotherapy in terms of effectiveness and side effects?
In terms of chemotherapy versus the new types of treatment, the new types of treatment tend to be more well tolerated because they are more specific to the tumor cells and they tend to leverage on the body's immune system to wipe up and wipe off the cancer cells. Chemotherapy kills both good and bad cells. Targeted therapy, targeted chemotherapy, immunotherapy tend to be more specific towards the tumor cells and therefore they are more well tolerated. They can be given over a prolonged duration of time as well also.
Okay, so if patients who come in with cancer sometimes feeling scared for the chemotherapy because the hair is going to loss, maybe they're losing weight, but if the using the targeted immunotherapy, it's going to be feel better, or like what, doctor, you can...
So for example, the targeted therapy that we just talked about, often they do not have hair loss.
Okay.
Even chemotherapy, nowadays we actually do allow patients the choice of certain chemotherapy drugs that may not result in significant hair loss. Targeted therapy right now is given in combination with chemo. Maybe someday in the future, if we identify a very, very good targeted drug, it can just be given on its own.
Okay, it's a good news for the patient for gastric cancer. So doctor, looking ahead, what are the key directions in OncoCare's research and development to make stomach cancer treatment even more personal and effective?
I think gastric cancer, or any cancer for that matter, is a life-changing diagnosis. And as we mentioned, every cancer is different. Nowadays, with understanding of the cancer, every patient needs to be individualized, and the coordination between the various specialties, such as the surgeons, the pathologists, the radiologists, becomes more and more important. So we want to have personalized medicine. We want to have multidisciplinary care. And finally, we also want to support the patient by recognizing their needs, whether or not it's physical, emotional, spiritual, right? And also provide nutrition support. So it is not just about managing the cancer itself, but managing all different aspects of it.
I see, okay. So I think many Indonesian audience maybe feel interested to come to Singapore for the cancer treatment. What do they need to prepare if they want to do treatment at Singapore, doctor?
I think it's important for us doctors to understand their cancer, right, as much as possible. So all the available reports, not just the reports, but also the images and also the specimens. If they've already had a biopsy and they said they've been told that they've cancer, right? We also want to confirm the diagnosis and do the additional tests on it.
Okay.
So having all these available may help to speed up the workup and may also speed up their starting of treatment once we get the right diagnosis.
Okay. Do you have something to add, doctor?
No, I think Thomas has given a very comprehensive answer.
Okay. I think it's a very good news for every patient, every audience maybe who watch our show today, that many good things happen now in the treatment for cancer. So I think this is a very good information for them. I hope it can give a new information for them. So they can search for the better medication, can do the better treatment, and do early screening, like what we've mentioned before, so it can save more lives. Thank you so much, doctor, for coming today to Kompas TV. I hope many audience can get many information from our talks here today. Thank you so
been a pleasure.
much. Ya, saudara, dari pembahasan hari ini kita belajar bahwa kemajuan ilmu kedokteran tidak hanya berbicara tentang teknologi, tetapi juga tentang harapan. Terobosan terbaru dan pendekatan personalized care menjadi bukti bahwa setiap pasien berhak mendapatkan perawatan yang sesuai dengan kebutuhannya. Deteksi dini tetap menjadi kunci utama untuk menyelamatkan lebih banyak nyawa. Apabila Anda tertarik mengenai pengobatan kanker yang tersedia di Singapura, Anda bisa menghubungi nomor yang tertera di layar kaca Anda bisa ke website atau mungkin akun media sosial supaya Anda bisa mendapatkan informasi yang lebih banyak dan sesuai untuk kebutuhan Anda. Saya Melisa Gandasari pamit undur diri. Terima kasih atas kebersamaan Anda. Kita jumpa lagi di lain kesempatan. Sampai jumpa.